The sinusoids very frequently are short note, and so many times it is being said sinusoids replace capillaries in some organs. Now tell about sinusoids. If somebody asks you, now you can answer a lot. Okay? Now coming to sinusoids. What are sinusoids? These are the large irregular vascular spaces seen within the parenchyma of an organ. They are large in size because they are larger. The lumen of a sinusoid is more than that of a capillary. Okay, so they are large irregular vascular spaces seen in the parenchyma of an organ. Now the sinusoids, they replace the capillaries in so many organs like liver, spleen, adrenal cortex, adrenal gland. You have got the adrenal cortex, also hypophysis cerebri or your pituitary gland, hypophysis cerebri, bone marrow. Okay, we also have bone marrow. In all these places you see that there are sinusoids. These sinusoids basically they are seen in those organs where there are plates of cells or cords of cells. Those organs which are having cords of cells or plates of cells, these are having sinusoids. Sometimes if you see the sinusoid, it is lined by endothelium, right? It is lined by endothelium. Here you can see the nucleus and you can see these cells. And here there are small fenestrations or small gaps. Such sinusoids are called fenestrated sinusoids. They are called fenestrated sinusoids. Sometimes you see the sinusoids, they are showing longitudinal slit-like appearance, and these are called discontinuous sinusoids. These are called discontinuous sinusoids, especially seen in spleen, because you are seeing the gaps are much larger and they are like longitudinal slits. The lumen size is up to 30 micrometers, much larger than the capillary. Okay, sometimes these sinusoids, if you see, there is one venule, there is another venule. Joining to these two venules, there can be a sinusoid. So if you see, if you see, there is one venule, okay, there is another venule. So here there is a gap or space, that is the sinusoid, joining venule and a venule. So this is seen in liver, where the sinusoid is joining both venules. Sometimes you have got arteriole and then you have got venule, and the sinusoid is joining an arteriole with a venule, and this is seen in spleen. Are you able to follow what we are trying to talk? The sinusoids, they permit the exchange of the nutrients or passage of the cells which are much larger than what a capillary does. Now we are going to learn about capillaries. Capillaries are the smallest blood vessels. Actually they are derived from the word capillus, which means hair. Capillus means hair. They are the smallest blood vessels. Now if you see a meta-arteriole and then you see a venule. Now this is venule and here you are having meta-arteriole. Interposed or present in between a meta-arteriole and a venule is capillary. The endothelial tube which is interposed between the meta-arteriole and venule is called capillary. These capillaries, they are in the form of a plexus. The diameter of a capillary is just 6 to 8 microns. Normally, there are very small capillaries, present in the brain and in the intestine. There are large capillaries which are present in the skin. In the skin you are having larger sized capillaries, whereas in the brain and the intestine you are having very small capillaries. Now let us study about the structure of the capillary. Now if you see, these are rounded, right, and these are made up of, you are seeing, here you are having the endothelium. We are trying to draw the endothelial cells. So here you are having the endothelial cells. Yes, you are able to appreciate. So these are the endothelial cells that are being present. Now this is the basal lamina. Surrounding the basal lamina there are adventitial cells which are also called as pericytes. These are the adventitial cells which are called as pericytes. This is the endothelium which is present lining the capillary, and it is present on the basal lamina. It is present on the basal lamina or the basement membrane that is formed by glycoprotein. So there is a glycoprotein which is forming the basal lamina. Over this basal lamina you are having a single layer of endothelium, and supporting it you have adventitial cells or pericytes. Coming to the types of capillaries, you have two. One is the continuous capillary which I have drawn, and other one is fenestrated capillary. What are fenestrations? Fenestrations are holes or gaps which are present that are very small in size. Now if you see the fenestrated capillary, again please see, so here you are having the gaps, okay, and again you are having the endothelium. Again you are having the gaps, again you are having the endothelium. So this is the endothelium, and these are the fenestrations that are present. So these are the gaps that are present. So that is the fenestrated capillary, whereas this is the continuous capillary. The fenestrated capillaries, they are present in the kidney, that is the renal glomeruli. In there you have got the fenestrated capillaries, whereas here these continuous capillaries are present in the intestines, okay, and in the lungs you are having the continuous capillary. Now what is happening in the capillaries, if you observe, because they have got a very narrow lumen, if you take, this is the capillary, the RBCs come and stand in a file, a single profile they are standing. So what is happening through the capillaries? There is exchange of water, exchange of electrolytes, there is exchange of gases, there is exchange of nutrients. So all these things are being exchanged through the capillaries. Water, gases, nutrients, metabolites. They can move out and in of the capillary. So there is exchange between the blood and the interstitial fluid. So these things are being exchanged. Thank you. We are going to learn about venules. What is the difference between the venules and the veins? That also we are going to learn. So when we talk about venules, okay, what are venules? Venules are the smallest veins into which the capillaries drain. Venules are the smallest veins into which the capillaries drain. Okay. If you see the lumen, it is 20 to 30 microns. You can take the circumference of a venule. Okay. If you see these venules, you know, you have got the microscopic structure we are talking. You got endothelium, that is a single layer of squamous cells. So here we are having the single layer of squamous cells which are resting on a basement membrane. Yes, so this is the basement membrane. And then you have got tunica adventitia, which is made up of collagen fibers. This is tunica adventitia, which is made up of collagen fibers that are running longitudinally. So what are you having? In the tunica adventitia, we are having collagen fibers which are running longitudinally. Okay? In the tunica adventitia of venule. And then you have got some cells which are very flat. Okay? And these cells are called pericytes. These are called pericytes. In a very close approximation with the endothelium of the venule, you are having these cells called pericytes. And if you see this venule, what is the difference between vein and a venule? You know, veins, they carry into your blood. And when we talk about venules, these, we said, the capillaries drain into the smallest veins and they are called venules. Especially when you take the post capillary venules, especially when you are trying to talk about the post capillary venules, they are having the capacity for exchange of gases. They are permeable. The post capillary venules, they are permeable for the nutrients or the substances to pass from the blood into the neighboring tissues. Okay, from the blood into the neighboring tissues, even the leukocytes can pass. Even the leukocytes can pass from them, that is from the lumen of a venule to the surrounding tissue. Thank you.